Yeah, I mean, this is the Cape Cod Regional Government Assembly of Delegates, Standing Committee on Health and Human Services. Pursuant to Chapter 2 of the Act of 2025, this virtual meeting of the Cape Cod Regional Government Assembly of Delegates, Standing Committee on Health and Human Services will be conducted via remote means only in accordance with applicable law. Members of the public may watch the meeting through live real-time broadcast at www.youtube.com backslash user backslash Barnstable County. A public participation guide and meeting documents are available in advance at https www.capecod.gov. The County of Barnstable does not discriminate in the administration of its programs or activities on the basis of race, color, religion, national origin, disability, age, sex, sexual orientation, gender identity, or other category protected by state and federal anti-discrimination laws and regulations. Reasonable accommodations for people with disabilities are available upon request. For more information to file a complaint, please contact Justina Marchak, Barnstable County ADA Non-Discrimination Coordinator at jmarczak@capecod.gov. Call 508-375-6646 or visit www.capecod.gov. Members of the public may also attend the meeting remotely through Microsoft Teams, and the link is available on the website. I think that's back to you, Chair.
And thank you, Mr. Clerk. And will you proceed with the opening formalities?
Sure. I believe first it's a moment of silence to honor our troops who have died in service of our country and all those serving our country in the armed forces. All right, next is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I believe that's back to you now. Or would you like a roll call?
We proceed to a roll call. Exactly.
All right. Delegate Frederickson. She is here. Delegate Gallagher, I believe, is still trying to get on the call. I'm going to help him in a moment, but you do have Elizabeth Harder here if he continues not being here. Delegate Green?
Here.
Delegate Harder, are you here? Can we hear you?
I'm here.
All right. And then Chair O'Malley?
Here.
And Vice Chair Ty?
Here.
All right. That is a quorum, Mr. Chair.
Thank you. So, right, I'm not muted. Good. So this meeting is to hear on proposed resolution 2025-13, which is a resolution submitted to endorse legislation now on now in committee on Beacon Hill, known as Medicare for All in Massachusetts. It's a pair of bills. I think it's pretty clear everyone understands that the state of healthcare is in crisis around several fronts. Number one, skyrocketing costs, which are essentially unsustainable. We know that. Combined with, at this point, the impending loss of coverage for what will be millions of people, with reductions in the ACA subsidies and with increased barriers to Medicaid enrollment and sustained enrollment, all kinds of administrative obstacles being put in the way. So there are going to be millions of people across the country and in the state alone losing access to care. That goes along with, part and parcel of that is what everybody knows about the access to primary care. It's what I did my whole life. And now it has become a real challenge to anyone who loses their source of primary care to find a replacement for it. At this point in time, the only primary care practitioners who are establishing on the Cape are all sponsored by and supported by Cape Cod Healthcare, which is in financial difficulties of its own and is facing financial difficulties as the changes in coverage for people coming into their doors. You know, the hospital has to see people, has to take care of people. It cannot turn people away because they don't have coverage. So with larger numbers of people coming through the doors at them showing up at the emergency room, the hospital faces stresses so that their ability to underwrite and sustain the primary care practices is going to be taxed. And the net upshot of that is, you know, I even use the phrase in the regulation, care delayed is care denied. And these have implications for people's health. These are they're intractable, and for all the years that we've talked about it, there has not come up with a solution. Obamacare, the Affordable Care Act, created access to care for tremendous numbers of people, really made a big dent in the issue. That, of course, is under attack right now. So, what we're hearing here, Clerk Fletcher.
I apologize for interrupting you. I did, once roll call was over, try to get Delegate Gallagher on, but I know that we've got two staff members on who are here to talk about regional government food access that was actually on the agenda ahead of the Medicare for All resolution. So
Yes, I'm sorry, I missed that.
it's okay. I just didn't, I know that I didn't want staff to have to wait unless you were doing it on purpose.
No, it can happen. That was an oversight.
It's
I was
okay.
too eager to go. So let's hear this report on. I think that's super important as well.
Sorry
Food
to
access.
interrupt again.
Hi, everyone. Thank you so much for having us today. I'm Andrea Scarpolini. I'm the Food Access Coordinator with Cape Cod Cooperative Extension, and I'm joined with my colleague, Kim Concra.
Hi, everyone. Thank you for having us.
So we were asked to come on and give you an update with what is happening in nutrition and food access. It's very timely. It's always a hard time of year for people on the Cape, but across the state needing help with food and food resources during Thanksgiving and the upcoming holidays. On top of that, with the reduction and with the federal government shutdown and the SNAP benefits on hold, we have been seeing such an increased huge number of people needing the pantries and asking for food resources on the Cape. So from what our pantries and our meal sites are stating is that they're seeing a 30 to 40% increase of usage on at the pantry level. Most of these people, the increased need that we've been seeing is people who have never used the food pantry before, or because they had SNAP benefits, and that was able to bridge the gap in what they needed for their household food supply, or people who just haven't had to use the food pantry in a really long time. So it's been like 10, 15 years, and now they're coming back again. And Kim and I just wanted to give you a quick update with what the county's response has been to this increased need and how we've been working together to work with our community partners. Kim, did you want to chime in before I go further?
I think what stands most important to me as a nutritionist working with Cooperative Extension is thinking about people now putting or having been putting their monies that may have gone to rent towards food. Now that maybe SNAP is back on again, where is that money going to come from to replace that? So if I had $400 that was going to go towards rent and now had to go towards food during the shutdown, I still have to pay rent. So where would that $400 be replaced from? So that could impact housing issues that we're seeing as well.
Great. And go ahead.
Yep. No, I was just going to say, so basically shuffling resources from, rent and even medical care onto food.
I did put together a few slides. Let me see if I can share my screen. Let's see. Are you able to see that?
Yep.
Yeah. Okay, great. So this is, I'll just be quick. I know you have a lot on your agenda for today, but this is just a few things of what we've been doing in response to the food needs on the Cape. The first, obviously, we're always looking at strengthening the local food system to reduce hunger on the Cape. So what does that mean? That means looking at our food suppliers, our food distributors, who are the end users with all of that. Let's see. In response to the food, the kind of just the increased need, we did put together a food resource guide. You can find this and it's translated into different languages on Cape Cod Cooperative Extension's website. On top of this, we did create a food access request form, and this is brand new and it's been just really helpful. Sometimes when we reach a crisis point, it really moves us faster in a direction than we would have done it on our own. So during COVID, we had the biggest need was transportation. People were housebound in quarantine. They couldn't reach the food pantries or get access to food. So we created a food delivery program that would bring with the Cape Cod RTA during that time period to bring food from the pantries to the people who were shut in. Since then, we've continued with, not with the Cape Cod RTA, but with other community partners and volunteers like Capabilities, Community Connections. And the way we get our referrals are from our community partners. So a lot of healthcare referrals come in, WIC, Health Imperatives, the Council on Aging. So we get a lot of referrals coming in. And because of the increased demand all of a sudden with the SNAP, with the freezing of the SNAP benefits, it really forced us to put together an online request form really quickly and to streamline that process, which has been really helpful. So if you go on our website, you'll be able to find the food access request form. People can fill it out, or if you're worried about somebody, you can fill it out on their behalf and it gets sent to me directly. And then I will follow up with the person directly and just make sure that they know where all the resources are, do a little bit more vetting and education. And if necessary, we will add them to our homebound food pantry delivery list. We work with 5 different pantries across the Cape, and we can get food pretty quickly to people anytime that they request it. Please stop me if you have any questions. I can't really see with sharing the screen. But one thing that we have been looking at this, we're always trying to identify where the gaps are or where the threats are to our food supply or our food system landscape. And this is nothing new. We didn't predict that a government shutdown was going to happen or that it would freeze the SNAP benefits. But there have been other things in the past 5 years since I've been at Extension that have happened that have increased demand for our food system. And you can see here the influx of food during the pandemic. We had lots of people all of a sudden, well-meaning, doing lots of great food distributions, and then all of a sudden they stopped, and our food pantries were expecting them to continue, and then all of a sudden they stopped, and then there was a gap in food. So we saw that a lot. We see periodically Greater Boston Food Bank has 20 to 30% reduction of food that is being sent to the Cape, either due to volunteer shortages, staffing shortages, fuel. There's a number of different things, but it's most of our food. Kim, do you know the stats on how much food do we get for our pantries from the Greater Boston Food Bank?
I don't know the latest.
Yeah,
That would
it's
be not difficult to find, though.
Yeah, it's a considerable amount of food that we rely on from the Greater Boston Food Bank. And on a moment's notice, they might let us know, or the pantries know, that all of a sudden they're out of a staple or a certain item. And then all of a sudden our pantries are trying to meet that need somewhere else. The Cisco driver strike, that was another threat to our food system. It happened during the summer. I don't know if any of you recall it. But surprisingly, a lot of our pantries and meals programs order through Cisco. And all of a sudden that put a big strain on the food that our pantries were able to hand out to their clients. The infant formula shortage was another one. All of a sudden that happened. Nobody could have predicted that would have happened. And then trying to be creative and working together, we saw an increased need due to fuel and inflation costs. So we're always, those just happened in the last 5 years, and more are going to happen. And it's just guaranteed that there is going to be things that are going to happen. So at Extension, we are working with our community partners to make sure that we are we can't always anticipate what's going to happen, but to know where our assets are in our communities, who does what really well, and try to work together to meet those gaps and then come together really quickly in the face of a new emerging threat. One way that we're able to do that is we just kicked off the CARET program. It's the Community and Agriculture Resilience Audit Tool. It measures the food system resilience on the Cape. What we have done is we work together by pulling together a community advisory board of 30 to 40 members across all different sectors, healthcare, agriculture, aquaculture, marine. Oh my goodness, there's so many different people across the Cape who are participating on this. And we take a look at our food system and we go through, there's 7 different themes and 101 indicators for each core theme. And we start jotting down, okay, who's doing what? Where are the resources in this? Where is there a huge gap that we need to focus on? And what it does is it will put everything into metrics that we get to score. And then across the Cape, everybody can look at that data and that score. It's an online platform, and then we can update it every year. And we're all speaking the same language. We're all measuring the same way, and we have that data that we can rely on to try to stay ahead of trends as they appear. We're doing this in partnership with Cape Cod 5, the Marion Institute, and Love Live Local. And what we're doing with all of this information with the CARET program is we're going to be putting it together with a 2026 food system assessment for Southeastern Massachusetts, the 6 counties that make up our regional food shed. So it includes the islands, Bristol, Dukes, Nantucket, Norfolk, Plymouth, and Barnstable. And they're all doing the same CARET program that we are too. So we're all collecting the same type of data in the same way with the same shared language. And this is really important because we need to know how food and resources and assets are moving across through our counties and see how we can start picking up and strengthening each other when we need it. Just a couple more slides. One way we've been able to do that is with our local food purchasing assistance program. We were awarded through the state of the Massachusetts Department of Agricultural Resources, and the county extension applied for 2 grants totaling $1.2 million. And we were able to buy locally sourced produce, meats, poultry, seafood items from our local food producers and get it out to people in need. We were able to do that with a great array of different food producers, and it was a huge hit. We were able to provide all that food free of charge across all 15 towns on the Cape, and we used our community partners to do it. So it really strengthened our network. It was so successful that the Massachusetts Department of Agricultural Resources keeps asking the extension to share our knowledge and lessons learned, and they like to take our program and replicate it across the state. So we'll be speaking at the state level after Thanksgiving and sharing more about how we put this together, who our partners were, and why we think it was successful. And even though that funding ended, which we knew it was going to end, but even though it ended, we're not going to stop. So it just, that grant funding helped us put the infrastructure in place. And again, identify our human capacity and our technical and logistical assets that we have on the Cape. And it's just really exciting. The more we see other grants opportunities coming in, we are then able to rely on this infrastructure that we have already put into place, which is really exciting. There is a group of people who receive this local food purchasing grant, and we're all working together to create a long-term sustainable program so that we can not just purchase locally, but also within the state of Massachusetts. And then just lastly, to end on some new programs that are popping up as well. We have a lot of other food access initiatives that are going on, but I know you all are so busy. But we have partnered with the Sheriff's Department, and they are baking bread with their incarcerated women as part of their culinary cooking classes to help them with vocational training. That just kicked off 2 weeks ago, and we are able to use that bread and get it out to community partners across the Cape. So again, it's just another really fun initiative that just started, and it incorporates teaching and education as well as using the resources that we have already in existence. And I think sometimes these hard situations or increased demand in our communities just cause our partners to say, hey, what do we have here? What can we do? And let's do something new and work together. So that's a new program that's rolling out and it's just a really fun feel-good program. That's a win-win for everybody. Kim, did you want to jump in and say anything?
I think at the county level, I think I just want to say that, you know,
Did I
even with an
freak?
excuse me? Oh, okay. Sorry, I
Oh,
just
I
thought
don't
somebody
know.
said something. No, that the within the county, you know, we've been working with county health, you know, working with public health as far as, you know, looking at nutrition programs. We're also, even within extension, I feel like over the last several years, we've done a lot more with working with our horticulturists, with Buy Fresh, Buy Local. We've been able to do a lot of intra-department and inter-department work, and I think that just really bodes well for the county. So thank you for having us.
I would like to thank both of you for this presentation. This is the kind of thing that makes me feel proud to be playing a part in Barnstable County, Cape Cod Regional Government. You have you're working in real time. You are connecting with people who are the most at risk, most at need, trying to see to it that they have access. I want to make sure that I have a question about how all your programs are being publicized and how people are knowing about it. And at the same time, you are working with the producers, the agriculture, aquaculture industry people, and essentially trying to source product from our region, local product. That feels to me like a win-win in a very challenging situation. So kudos to you for this work, for the cooperative, for the extension, for doing this. It makes us proud. It's a big job. I mean, and I think with SNAP restored, maybe things maybe not quite so bad for the short-term future. But this is not a new crisis. This has been building for years. I mean, I know I work in a soup kitchen. We see the numbers going up all the time. I hear it from people who are in food pantries, how their numbers are increasing year over year. It's a reflection of a general economic distress, price increases and all of that. So thank you. Let me open this up to questions. I see Delegate Green. Go ahead, please.
Thank you, Chair O'Malley, and thank you to the extension, and also to I echo what Delegate O'Malley just said. It just makes me feel very proud to be doing the work I'm doing, to be able to hopefully support you. And that's what I wanted to say is, if you ever see an opportunity, or anyone in your department sees an opportunity for the assembly to help you, whether it's writing a letter of support for one of your programs or a resolution, I hope you'll reach out to us, because it just if it helps, I'm all in as far as that's concerned. And I just commend you for your hard work. Thank you.
Thank you, Delegate Green. I see Delegate Frederickson has his hand up. Go ahead.
Good afternoon. Thank you for the presentation. I was confident that the county had some programs in place or coordination efforts, which is really tricky. I had some experience in doing a lot of the different distributions over the length of my career, and I know it's always coming from different angles. And most importantly is getting the word out that those are in need. That is a tricky thing to do for a lot of different reasons. So I hope that your outreach gets out there as well as all the others. And the help for the food issue is coming from a lot of different places. And interesting enough, Mass Wildlife has a program which you may not be aware of. It's called Share the Harvest. They started a couple of years ago where because of basically the overpopulation, started on Nantucket of all places. They have quite a herd of deer out there. So they've got certified processors So the hunters who go get deer, they can donate the animal to the processor. Then it goes to 2 different pantries out there. That has expanded over the last 2 years incredibly, and it's a big deal. There is a processor certified in Sandwich, and I noticed that if you go on the Mass Wildlife website, you can see where you can get some of the venison that's being distributed. And then on the Cape at the Yarmouth Food Pantry, that venison is being distributed there. And, you know, it is a high protein, high value source of food for people. So I thought that was just a cool effort that
Yeah.
wasn't there before that is there now.
That's excellent. I hadn't heard of them before, so thank you so much. I look forward to digging in and learning a little bit more.
I love it. I love it. We just made another connection. That's great.
And I'll also send out, we do have a blog for our carrot program. So I will send that out to Owen and have him send it all to you. If you ever want to pop in and listen or share your thoughts or information, you can also go back if you have extra time and read and watch some of our previous recordings on some of our, we're moving very slow because it turns out we do have a lot of resources on the Cape and but you can go back and watch some of them. We're only on theme 1 and we thought we were going to be wrapped up by December and we have 6 more to go. So we might be at this.
I see a hand up, but I'm going to ask you, I circle back to a question that came up when I was speaking before is, are you comfortable that you're able to reach people in need? I presume you have things up at all the food pantries and the food access points. How is the word being publicized? For what
So
you
our
do?
community, our communications department at the county, Rebecca Westgate and Sonia Sheasley, they have been working really hard to put together as much information as they can out for the public. We also have over the past 5 years, we have worked to really create a network with all the different municipalities and social service organizations, underrepresented groups, to make sure that they know where the information is. And we have so many different networks and groups that we coordinate at Extension. So it gives people a chance to check in and say, hey, here's what's going on, and give people a chance to share. And but there's always more to be done. So it's not perfect, but it is moving in the right direction. Kim, did you want to add to that?
I think the only thing I'd add is I think over at least the last 5 years, I feel like the health departments have really gotten more into this kind of a focus also. And I think that's just wonderful. You know, I worked at WIC years ago and it was very focused on Title V. And it's, you know, now I feel like we're really focused on people, which is great.
And I would observe that what Ms. Scarpolini said about coordinating between the multiple providers and multiple sources of help fits right in exactly with the mission of the county, which is to tackle problems that are bigger than any one municipality can kind of get its hands around. And you know, we do, as you point out, we do have lots of providers, lots of resources here, and coordinating and seeing to it that things go more smoothly for them is really powerful. All right,
Oh,
Go ahead.
can I just say one quick thing? All of this work that we do is all relationship driven, and it's so important. I'm not an expert at all in any of this, but it's all just talking a lot and meeting people and remembering who's doing what and saying, oh, I think there's more there to follow up on. But all that to be said, the county has played a great role in that, because I've noticed that it seems that when people don't know what to do, they want to hear what the county's position is. They want to hear what the county is doing. And so not only are we getting questions with need, but we're getting people saying, I want to volunteer, I want to donate. What's your response to this? And just having that, it's just been really nice to know that people are looking to the county to play that role, and that they trust us, that we're not going to lead them astray. And they're just interested in where we're going to send them. And it was really fun to be able to say, hey, don't just do a food drive. That doesn't help anybody. Why don't you partner with a specific organization? Tell me what your mission is. And then being able to play that matchmaker role. And then they could directly fundraise or donate food that specific organization wants to do. So it's just been a really interesting role that I hadn't really seen happen in the past, like it's been happening recently.
And I think the county has made a determination years back, I mean, clearly under former Director O'Brien, that the public health component of what we do is very powerful. And if food security is not a part of public health, well, I don't know what is. So that's one of the primary determinants of health.
Yeah.
I see a question. I think this is Delegate Frederickson. Go ahead.
Yes, I'll leave you with this. It's more of a question. I'm sure you have some part in it. Deputy Speaker Guest and I spoke last week, and one of the issues that came up is emergency management. Should we get hit in a prolonged emergency, whether it be a hurricane or something that really impacts the entire area? Are you part of emergency management and food supplies at that time? You don't need to get too far into detail on the fact that, yes, you are, and you have some plans.
Yes, so we work really closely with Chip Riley, and he's just been a great partner. So he will periodically reach out and check in, and then vice versa. And also with the Red Cross and Salvation Army and United Way and our funders. But yeah, we if the time came and that he's needed help getting that information out, we have through the Council of Churches, there's just so many different avenues to make sure people knew in an emergency where that goes. But we rely heavily on Chip to keep providing us updated information. And then we created a community leadership group, which is just a diverse group of different people from all different organizations, and they come together, and Chip will come and talk to us about how to make sure we take care of ourselves and our neighbors in the time of a crisis. And we do that periodically. And then that gets to the diverse different groups that they represent. So there's more to be done, but it's always at the forefront of our mind, because Kim always said that, it's fine if there's all these resources or shelters, but if people don't know where they are, then what good is it? So it's both of that.
As you phrased it, coordinating and collaborating. Very powerful tools. It's great.
Yeah.
Anyone else? I don't see any hands up. All right. Are you comfortable with what have we heard what we need to hear for now?
Yes. Thank you so much for having us. I appreciate it.
And we
Yes.
really appreciate
Thank
your
you.
taking the time to bring us up to speed.
Oh,
Thank
sure.
you.
We'd love to come back anytime. Thank you so much.
Thank you.
All right.
Bye-bye.
Okay, so now back to where we were. Item 7 on the agenda, which was the resolution 2025-13. I laid out a little bit of the background. And I think it's important. Then I want to go to the fact that there is legislation on Beacon Hill that would set up a Massachusetts Healthcare Trust. It's established within the Department of Health and Executive Office of Health and Human Services, but is not actually a part of that office. That would provide coverage for all necessary healthcare services to all residents of the Commonwealth, without any cost, without any co-pays, without any upfront costs at the time of service, for what would be a really comprehensive package of healthcare services. And we're talking primary care, back to primary care, preventive care, and all of the usual stuff that most insurance covers, as well as vision, dental, hearing care, all mental health services, and powerfully long-term care. There is that's an appalling failure of virtually all current healthcare insurance to deal with primary care and to deal with long-term care. Nursing homes, they're phenomenally expensive, and basically they force almost everyone to go on to Medicaid and to essentially seed the financial equity in their homes to pay for those costs. This legislation is known as Medicare for All for Massachusetts. It's intended to encourage equitable access, available access across the Commonwealth to everyone, as I say, without upfront costs, and to lower costs overall by eliminating some of the enormous administrative complexity in our current system. And I can certainly speak to that as a primary care doc who used to spend most of my day talking with patients and seeing them, who towards the last years of my career spent about half of my day dealing with the administrative burden of interfacing with the various insurance companies, who each were trying to find ways to make a buck. These are the issues that bring this resolution before this committee. These are the issues that this committee would have interested in. These are the issues that have driven me as a long-term primary care doc to support this kind of thing. But in fact, the reason this resolution is now arriving on the assembly door is the result of a study that we have a universal healthcare activist group here on the Outer Cape, and a few years back we started a questionnaire, an Excel spreadsheet, frankly, that we distributed to every town. Well, 11 out of the 15 towns have done this, plus the county. And what it did was to ask their health insurance, their employer burdens and their employee burdens as well for their healthcare coverage. And using the formulas in the legislation, which is 7.5% or 8% on the employer and 2.5% on the employees after a $20,000 deductible, we calculated what each town would pay and what they would save. Most relevant to us here in the assembly is the reality that the county would save over $2.5 million a year. The fact that when we did this survey back for FY22, that was just about 2.1 million a year in savings. It's now over 2.5, is a reflection of the acceleration in insurance costs over these several years. So not only would the county save $2.5 million a year, money that we could use for a lot of good purposes, but every employee would see a reduction of about $2,500 a year less in their own contributions. That's the 2.5% after your first 20%. Anyway, that's the bigger picture. That's not so much why we're here in Health and Human Services Committee. For us, I think the consideration is this is a solution that would make access much more available. And I say, and this is not something I can prove, but I say as a former primary care doc, that the prospect of working in an environment where I would have none of those administrative burden responsibilities is so attractive. It would make me want to go back to work. It's why I got out. It's why very, very few docs are now working independently. They all need the big administrative apparatus that you see when you walk in the door of every single medical office, is cost control. And I think we actually did a calculation for if this were enacted, the towns as a whole would save. This is an estimate of about $60 million a year. We're talking about their costs for their town employees only. That comes out as I can't find it right now. Sample, I'm sorry. It's about $60 million a year. We are not talking about coverage for all of the Cape. We're talking about what our 15 towns and the county government are now spending. They alone would save about $60 million a year. Clearly, we are in a time when financial stresses are very real. The needs for money for housing, the needs for money for the environment. And so from these standpoints, I think this is kind of a no-brainer. That's in a sense how I wound up taking the results of our most recent survey that Carol Coppola did, which is just last month. These numbers are fresh as of last month. You know, when I looked at what the savings would be for us and what the implications would be, I said, this is we've got to get behind this and do what we can to support it. So where this is going is basically I'm looking for a resolution in support of this legislation. This resolution will join those from other Cape towns. It's already gone before town meeting in Wellfleet and town meeting in Brewster, both of which passed it nearly unanimously. And we are trying to encourage our delegation to put some pressure on the legislature to move this thing finally out of committee to the floor for a debate. So clearly, this committee is one of two. Economic Affairs would probably be the other place where it would have a legitimate, very strong legitimate role in discussing this particular regulation. But that's the background of it. I will open it up to questions and discussion. Delegate Green, please, go ahead.
Okay. Thank you, Chair O'Malley. I've been a strong proponent of universal health care for many decades, actually. And I would support moving this as a resolution. You know, whether it passes or it doesn't pass, or it gets one step further in the legislature, or it has more visibility as a result of this, I think that's a positive, and I support it, and I applaud all the work that you've been doing. I've been following it a bit, but it's remarkable. Thank you.
Thank you, Delegate Green. I see a number next is Delegate Frederickson, please.
Hi there. Yeah, this is an interesting topic. I never really gave it that much thought over the past few weeks during some of the debates nationally and what's going on. I listened to a lot of the debate. You can go on the state website and listen to the bill hearings. It's all, you can search it. It's pretty good. And there's a lot of stuff in there. I tried to read the law, and you know, I'm not the smartest one in the room, so a lot of stuff was hard to comprehend. But I walked away with not enough information. Like the concept sounds terrific, seriously. And of course, the current you know, Affordable Care Act is really not doing exactly what it was supposed to do. I think we're seeing that on a national level. So that something's got to give. And what I think we need a few more questions, a few more bullet points before we go to a vote on the assembly. Just a little more explanation of what it does and what it doesn't do. For example, one thing I am not certain of, what does it do for insurance companies? I'm not asking for an answer. I don't know. Like currently, we all have insurance by different ways. But what does that do? Does a town employee, for example, that has Blue Cross, does that go away? Is it one big just state insurance company? Do the current medical professionals, how do they feel about it? I know they're kind of a lot of primary care, they've gone to that concierge services where you have to pay a certain amount just to be able to have an appointment with them now, even though you haven't, and the insurance doesn't cover it. It's like, that seems like, wait, what am I paying insurance for if I got to pay for another fee just to get to see the doctor? So there's some of that stuff. It just need a few more answers, I think. And also, what does it actually cost an individual? Let's say you can pick the average town employee that's on one of the health plans. It'd be nice to be able to differentiate what that means. It talks about, there's a couple different fees in there. You talked about the if you're a private, you have self-employed, it's 10%, you pay 10% of your income. An employer pays 7.5%. There was a fee, I thought 2.5% might have been a fee that I heard. Brian, you can correct me on that.
That's correct.
Yeah.
Yeah.
So it'd be nice to be able to point out what these pieces do. There's a lot to it. My guess is that it's a long way. It's been got an extension order that's put off till after the first of the year before they do any action on it. So my guess there'll be a lot of debate over it. And I imagine whatever happens nationally over the next few months, because it sounds like something's going to happen one way or the other. Whether it's good or bad, I don't know. But it would be nice to have a little bit more information, like some of the key points that would concern the average person to understand, and then we can put it out there and so put it out there for vote. Does that make sense?
I appreciate your questions, and I'm going to take it upon myself to try to answer some of them, since they will come up again. What happens to the insurance companies? They still exist. They just can't sell health insurance in this state. They cannot sell the product. Why? Because frankly, that would represent kind of a fraud. We're covering you for coverage that you already have. We'll sell you coverage for what you already paid for. It'd be like somebody selling you fire department insurance when you're a resident of your town. You're covered. You don't need it. So that would go away. There is provision within the bill for retraining and career redirection for the thousands of people, many thousands of people that the private health insurance industry employs. And there's lots of them. How do docs feel about it? I can tell you, in the primary care world, docs are behind it. I mean, this is something I have been talking about with people forever, and I obviously played a big role in Cape Cod Health. I was very tied in there, and I know in primary care it's very much supported. That's because the administrative burden of multiple insurances falls very heavily on primary care. They are people who do lots of little services. They get a little bit here, a little bit there, and they make their income that way. They're not doing big operations, a few a week. When you do lots of little services, when you get denied, it becomes not worth it to go after it. It's too much pain in the butt. Number two, every insurance company sells policies that has its own strategy for how they will manage their patients and how to minimize their costs, which means that as a primary care doc, each person who comes through the door has a different set of what I have to pay attention to, what codes I have to use, who I refer to, what meds I can use. It becomes, you pull your hair out. So in that area, I have no question. I'm sure that there are some, and primary care docs will be facing a bump in Medicare rates. It's estimated that will be about 10%. And that actually brings me to an important point, Delegate Frederickson, which is you said something to the effect of there isn't enough detail. That despite the fact that this legislation is somewhat 90 pages long. It's enormous. As you can see when you go through it, it's very strong on what the administrative structure would look like. It's very, very detailed in that there's structures for fee development and make sure the coverage is regional and to evaluate new therapies and how much we're going to pay for them and yada yada. That whole administrative thing is laid out. All the policies that are likely to come out of that will be made by the people who actually do the work. A very clear, for instance, is how will primary care docs be paid? That's not specified. And that's a huge issue for discussion in across the boards and all of us who look at healthcare reform. So yes, there are elements that are not fully defined, but what we're doing here is setting up a structure that creates a mechanism for making those decisions. What's it going to cost? You're quite correct. The healthcare tax is for an employee 2.5%. So let's see what that means. Let's take somebody who's making a modest $50,000 a year. The legislation provides for a $20,000 deductible per individual. That brings our basis down to $30,000. Then 2.5% of that, $750 a year. $750 a year covers everything. Hello? I mean, people say, how can that happen? How can that be? How can you cover more people for more services for less money? That is a very sad testimonial to the insane inefficiencies and profit making in our current system. The profit making is huge. So, the administrative inefficiencies are such that Medicare operates on about 2% administrative cost. Under Medicare, all the claims go in, they're all the same. You fill them out the same. The process, the diagnosis, the whole business for a doc is very straightforward. In the private insurance world, we're talking about 25 to 30% administrative burden. That's advertising, salaries, profit, selling their product and such. So, it's doable. There's a very reputable, on the MassCare website, there's a very reputable healthcare economist out in UMass Amherst, Jerry Friedman, who writes an analysis, a very in-depth economic analysis that even incorporates the fact, it has to incorporate the fact that we will be covering more people for more services, and yet he makes it pretty clear the numbers work. We can do it and do it less than what we're doing now. So I think I grabbed all of your questions.
Yeah, when I meant lack of detail, I meant to be able to just refine some of the most common points that people would want to know, like what's it going to cost? Just what happens on my current health plan? A couple of those things. So
yeah,
that's what I mean. Trust me, I did. I went through and tried to understand. It's a very lengthy. It's going to be up for a lot of debate. But I think for our purposes, if people understand the nuts and bolts that really impact us, I think that might be a little better. And there might maybe only be 5 or 6 different things that you have to put out there.
And I am appreciative to you for making the effort to go and look into that. It's a lot of reading. It's a lot of reading, but this has been in development for 10 sessions anyway, 20 years. And what happens every time is some of the new questions get worked in and details get added. Every time we bring it around, it's all right, here's how we'll attend to that question. So is it all there yet? No, I'm sure as we go into it, if it passes, as we go into it, there'll be millions of questions as exactly how we set it up. But that's the gist of it. Okay.
Thank you.
Does that answer? Thank you. Delegate Ty, please. I see a question.
I want to say thank you for all of the work that's been done in that. I also want to thank Representative Frederickson for the questions. I didn't realize I had any until he said that. But you did answer the ones that to my satisfaction. Okay, so you've been doing this for 20 years. How much longer is this going to take? Is this now being worked on and looked at right now? Yeah, I got another 20 years, but I don't want to waste it on trying to do this insurance. I want this taken care of. So what's the game plan if and when this resolution is passed? What's the game plan?
Well, in a sense, what we're looking to do, it is currently in the Joint Committee on Healthcare Finance, which has been its graveyard for all of those 10 sessions that I'm familiar with. Under the old rules of the Massachusetts legislature, of course, we never get transcripts of hearings. We don't get votes. So the bill has been referred for study over and over. There is an element of optimism this session because the deadline for closure on hearings on this has been extended and extended again. It's still open. So they haven't shut the door on it this time around. What we're hoping clearly is that each of the towns that has done this, I can tell you, it is uniformly the case for every single town that we've surveyed that they save money, and they save a lot of money. It's also the case. So we're hoping to build, in essence, some push from that sector alone, the municipalities, to say, hey, we could do the work we have to do a whole lot better if we weren't spending so much money on our employee health insurance. That's kind of the game plan here. Does that answer that one?
I'd like to go forward.
Yeah. Do we have other questions? Okay. There being none, do we have a motion? I take a motion on recommending this to the full assembly for consideration.
So moved.
Second.
The second was, I'm sorry, Lily. Thank you very much.
Delegate Green, yeah.
Thank you, Delegate Green. Okay. Clerk Fletcher, will you call the roll, please?
Can I just be clear? It's a favorable recommendation to the full assembly. What are we voting on?
To make a favorable recommendation to the full assembly to approve and to endorse and to communicate that endorsement to our delegation, to the governor, to our senators, and our federal rep.
All right, Delegate Gallagher. Oh, I'm sorry, Delegate Frederickson. You are alphabetically first.
Yes.
Delegate Gallagher.
Yes.
Delegate Green.
Yes.
Vice Chair Chair O'Malley.
I guess so. Yes.
And Delegate Ty.
Yes.
All right. That's 5 in favor, Mr. Chair.
Thank you, Clerk Fletcher. Do we have any further business other than adjournment? That would be next on the agenda. Then
Don't
will
think
you call that roll?
Do you have a motion to adjourn?
Oh, you need a motion
Yeah.
to adjourn, which I will make.
All right.
Second.
All right, Delegate Frederickson.
Yes.
Delegate Green. I'm sorry, Delegate Gallagher.
Yes.
Delegate Green.
Yes.
Vice Chair Ty.
Yes.
And Chair O'Malley.
Yes.
All right, I believe that's everybody.
Thank you to everyone. And
Thank
thank you,
you.
Clerk Fletcher.
All right.
Have a good evening all.
Cheers.
Thank